I'm Dr. Andrew Koenigsberg of Gallery 57 Dental. Welcome to Floss Talk, where we discuss oral and dental health issues with healthcare experts. Tonight, I'd like to welcome Dana Hockenbury, a certified orofacial myologist and a licensed speech pathologist. Welcome, Dana. Thanks for joining me.
Thank you so much, Dr. Koenigsberg. Thank you for having me.
Dana, can you tell us some of the conditions that orofacial myologists treat?
Sure. We treat patients that demonstrate orthodontic relapse, which means that when the braces come off, the teeth have moved back to the previous position. We also treat patients that have a tongue thrust, swallowing pattern, where the tongue goes between the teeth or out the mouth when they swallow. And also, we work with patients that have prolonged sucking habits with their thumbs or their fingers.
So, Dana, that's very interesting. You know, there are reports that up to 2/3 of adults have orthodontic relapse. What kind of treatments do you do to help these patients and prevent the teeth moving out of position?
Sure. So I provide exercises that the patient must do at home consistently. And those exercises are designed to tone the muscles of the face, the lips, and the tongue. And most importantly, to position that tongue up against the roof of the mouth where it belongs. The lips are together, and that ensures nasal breathing both day and night.
Dana, what age range patients do you see with these problems?
Sure. Well, with the children who I treat that suck their thumbs or their fingers, I can start as early as 2 to 3 years old of age, and I also see digit suckers up through teenagers and adults. So with those that experience orthodontic relapse, those would be the teenagers through adults, and the tongue thrust swallow pattern of patients that demonstrate a tongue thrust, those would be, again, children through adulthood.
So that's interesting that these habits can be treated really at any age.
Absolutely. All it takes is a committed patient that they really want to improve.
Dana, I see a lot of patients in my practice who are mouth breathers, and they're uncomfortable and there are dental health risks. Is that something you can treat, and if so, what do you do?
Sure, I see a lot of mouth breathers in my practice too, doctor. And I first ask them if they have a history of difficulty breathing through their nose, meaning do they have a deviated septum? Did they ever go to an ENT to have that ruled out? Do they have, I look inside their mouth and I see to see if tonsils are inflamed or enlarged, if they have a history of inflamed or enlarged adenoids. If those are still a problem, I refer out to an ENT so they could look at that further. I also ask about allergies. Maybe they need to see an allergist to take care of those conditions. And once they've been cleared, they come back to me, and I provide exercises that tones the oral complex, the mouth, the lips, the tongue. Get the tongue sitting up against the roof of the mouth where it belongs at rest, with lips together, and that ensures nasal breathing consistently during the day and while they're sleeping at night.
That's great, and that's very helpful because mouth breathing is uncomfortable for the patient and also leads to inflamed gums and can lead to an increased risk of cavities. So it's good to hear that there's a treatment for that.
Absolutely, and it's the healthiest way to breathe.
Dana, thank you for joining me on Floss Talk.
Thank you so much, Dr. Koenigsberg, for the opportunity to talk tonight about orofacial myofunctional disorders.
It was very helpful to hear how many of these common and disruptive conditions can be easily and conservatively treated.
I agree. You know, the therapy is accessible and it's easy to do at home.
Great. Please join us and see our other Floss Talk videos.